We will move on to public input. Public input is an opportunity for a citizen to come out and speak about something that's not on the agenda. You will have 3 minutes, and just know we will not be engaging when it comes to public input, and we'll go from there. So I have one right here from Mr. Rob Brown, if you'd like to come up. And then if there's anyone else, come up, and there's also documents, a request form that you would fill out and state your name for the record. All right.
Good morning, Rob Brown from Kelseyville. So the subject is roads. Recently, you guys addressed an issue up on Cobb of a contract that was let and some issues with the roads up there. And I think it's important to also recognize the other work on the roads that's going on. The county crew has been working on 37 miles of road that they're working on overlay, chip seal, and various maintenance that they're doing. And they're about halfway through it. And there was a day when I didn't mind working in the 100-degree weather, doing paving and all that, but it's not today. And I have a lot of respect for somebody who does that. But the work that they're doing right now, the talent that you have in the road crew right now is I don't know that we've ever had that before. And my request is this, that the board, go look and see what they're doing. It's unbelievable. You can't. It would cost millions to get that kind of work done, and it's a testament to their commitment to the county, to their trade, and it's also a testament to the leadership by, at a risk of not mentioning somebody, but Jim Hale and Chris Prather obviously are the ones that I see out there the most. But they're not doing it for the money. We all know that, but they are doing an exceptionally good job on these roads and saving the county a lot of money. So if you're looking for a place to spend money, put it towards the county crew. Let them get all of our roads done, because they're doing an amazing job, and I really appreciate what they've done.
All right, thank you. Any other public input? We'll let the gentleman go first, and then Maria, I'll have you come up. Sir, come on up and fill out one of these citizen input forms. You can actually fill that after and hand it up. Yeah, just state your name for the record.
Khalil Abdul Jami, Kelseyville.
Right.
I've been up in this county since 2002. And I've seen a lot of growth from when I first got up here, like the Rite Aid in Clear Lake, or the bank, which was Wachovia and Citizens Bank, which is now Wells Fargo, or the turnabouts, all the turnabouts that have been established. Upper Lake, the one right there on Olympic, the one right there in Hidden Valley. Well, what I really like is what they've done in Clear Lake along the that park area right there by the police station. That was very inspirational. A little bit more of those things should be put into the communities, because it's starting to grow, and we're starting to attract more people from the cities who have the perceptions are wider. I'm not saying that when you live in small town communities, and especially in the country, the perception is not as wide as until you leave and you experience the world. And when you come back, your perceptions are wider. I grew up in the city in Oakland. My mom is right here. And slow growth. but it's got to be something else. The communities need something else that it doesn't have. And there's not a lot of job opportunities here. I would suggest to you guys that you either create something here with the space or bring it in. Because there's really not much to do. And the homeless, it's not a lot of homeless, but you need to have something for them, a little more resources or something for them to get them off of the streets, because the winter is coming. Unless you want a bunch of dead homeless people and saying that you can't protect them and help them. They're the ones who need it the most. And jobs, creation of jobs. That's all I say.
Thank you.
Thank you.
And you can turn that in up here when you're finished, or thank you so much.
Thank you.
Maria?
Wes, would you care to join me? Maria Turner, Community Development Director. The Community Development Department team is dedicated to superior public service. They are smart, they are hard workers, and the county has invested significant funds to train them and make sure that they know what their jobs are. One of the things that we cannot train is a caring heart and a dedication to the community. And so I appreciate the board welcoming opportunities for us to point out the exceptional. Wes Nelson, one of our code enforcement officers, was out on a site visit August 8th, 2025 on Bottle Rock Road when he noticed a smoke plume. He called that in and it became later known as the coal fire. He didn't just leave, he stayed on site there and went to Penson Court, started banging on doors and notifying neighbors, making sure everybody else was aware of the emergency. And he stuck around until relieved by emergency personnel. We are presenting Wes with this certificate because y'all won't let me give him, like $1,000 or something. So, but,
Sure he'd rather have the 1,000.
right? But the certificate and the paper is just an understatement of the appreciation that we have for the dedication of these members of our team, and how they care and look after the community when they're out doing their jobs. Thank you.
Thank you.
Come on back over here, Wes. So one of the constituents that lives on Penson Court reached out to me because he wanted to know who this person was that came to his house and called in the fire and warned him. And he said, "You have incredible staff." And he gave me a description of you, and then we had to figure out what team you were on. So it took a little investigating, but thank you so much. The constituent wasn't able to make it here today, but he did really want me to know how much he appreciated you. You came to his door and you warned him and you called the fire in, and that fire ended up being very, very close to those homes. So you potentially saved property and lives.
It could have got bad real fast, but
Yeah.
I appreciate the recognition, but I don't feel like I did anything different than most individuals would in my situation. You see a fire, you address it, and you look out for the community. I just hope that's what everybody does.
We have the very best staff that work for the County of Lake. Thank you so much, Wes.
All right. Any other public input?
I know it's public comment, we're not supposed to engage, but Mr. West, that response is exactly why you're being recognized, so thank you. Thank you for what you do.
Just, thank you, appreciate it. Have a blessed day.
You too. All right, on Zoom with Donna.
Good morning, Board. Donna Makowitz, Redbud Audubon. I'd like to thank the Board and especially Supervisor Pyska and Chief Climate Resiliency Officer Tribal Liaison Terry Logsdon for continued community outreach awareness on the Mediterranean or borer beetle, or mob. Mob was first discovered in Napa in 2019, imported from France in 2017 on barrel staves. It's now attacking valley, blue, and some black oaks. In 2023, we saw dozens dead, 2024, hundreds dead, and already in 2025, tens of thousands of valley oaks have been lost. It's spreading at an exponential rate, echoing the devastation of Dutch elm and chestnut diseases on the East Coast, and we urge the Board to halt all removal of healthy trees, especially blue and valley oaks, and promptly remove and destroy all infected trees for the future oaks of this great county. Thank you very much.
All right. If there are any other public input, if you'd like to come up to the microphone.
Okay, here we go again. My name is Siva Jameli. I have worked for you in this county for I'm on my 36th year with In-Home Supportive Services. I am pretty sure that 4 of you know who we are since we helped endorse you and get you on the board. We are here because we're tired of having to fight every tooth and nail to get a penny out of this county for our employment. We're the largest employer in this county. Do you know that? We employ over 2,200 people. And when I say we're the largest business, I mean everybody, including ambulances, hospitals, you name it. We're more than them. Sorry, I'm upset. When I started this job, it was 1990 in January, and I went in to apply, and shocked. All I had to do was tell them who I was and what I do. But it was $5.75 back then. And I was ecstatic. I said, oh, good, I get 50 cents above minimum wage. Guess what? Every year that the minimum wage went up by 50 cents until it reached $10 an hour, and then they quit. We didn't get no more raises anymore until our unions came in. Why do we have to do this with you? You come to us during the negotiations and offer us 25 cents an hour more. Whoopee, can you live on that? I don't think so. Do you realize that rent in Lake County, if you're lucky, I'm lucky. My client passed away and I got a place for $400 a month. But other people are paying anywhere from $1,000 and above, and some of them aren't even livable, but they stay there because they don't have a choice. Why? Why? Do you people realize that when we are working, going in and taking care of these people, that we are saving our county money? Because if they had to house those people in a nursing home, first of all, in Lake County, we don't have enough, because there's more of the recipients than there are providers. So you're talking 2,300 or more people that would have to be put somewhere. But no, we go to work every day to try to keep these people in their homes so they can die with dignity when it's time. Why do you fight us? We get $17.15 an hour right now. Do the math. I started in 1990, and I now only have $17.15 an hour, and I don't even get benefits. The only benefits I get is vision and dental, and I pay for those. Plus, I'm on Medicare. So please, stop. Listen to our proposal. Give us what we're worth. Because if you didn't have us, what would you do? You couldn't house all the people that are recipients that need somebody to take care of them. So stop. We want $20 an hour. We deserve $20 an hour. We don't get benefits,
Yeah,
so we
you're 3
deserve
minutes.
20. I
Wrap it
know.
up.
I'm done. I know. But I'm sorry to sound like I'm angry, but like I said, I'm 35 years I've been doing this. I'm 70. Why do you make me fight every time we want a small raise? Why do I have to come before you, yell at you, and be angry? It's not right. We deserve better. Thank you.
All right.
Hello. My name is Eleanor Hayes. I am an IHSS provider here in Lake County. I'm also a mom of 3. I want to speak in favor of a strong contract for me and thousands of home care providers here in Lake County. At various times, I've had to work 2 to 3 jobs, support my family. The IHSS wages is not enough to cover all my family costs. I was fortunate enough to get a used car last year, but that was because I would take all my clients on the bus to get to their appointments and everything. When you have kids, you want to have some money saved up just in case anything unexpected happens, but I can't do that right now. Any savings I pulled together recently has had to go straight into emergency home repairs. If the wages were higher, it might be able to actually save for the future. I'd like to get stable enough so I can have free time to spend with my family and maybe plan some off time. If we can ensure decent wages for care providers, we're going to lose, if we can't get decent wages for providers, we're going to lose good caregivers to other industries. And the people who receive our care deserve compassionate people who love the work. That's a really important part of the work we do. We build strong relationships with our recipients. Our IHSS providers get very close to their clients, and those relationships are part of the care. It means a lot to recipients that they have a responsible person they can trust to help them. For providers, these relationships are why we love the work. And when our clients pass away, there's a lot of emotional impact. So far, I've lost my mom and some other clients. I was really depressed for a while, losing both of them. This is a very common part of the job. It never gets easy. Right now, I take care of a 91-year-old woman who is bedridden. I physically move her, I bathe her, I change her. I help her in and out of her wheelchair when we can. Recently, there was a wildfire on Mount Baldy. I had to get her and her disabled son out of that house. I know that she might not be with us for long, but that's the difficult thing that we sit with. Anyone involved in working will tell you that. And I think that's the part of working that many people don't think about. The work we do in the county is so important to seniors and people with disabilities in Lake County. The people who do this work need some security and stability. And I'm hoping we can agree to a strong contract that for the sake of my family and for the future of the care of Lake County. Thank you.
Thank you.
Good morning, everyone. My name is Diana Williard, and this is my son, Anthony James. I'm an IHSS provider and an SEIU 2015 union member. Anthony is my IHSS recipient. Thank you for giving us a chance to be heard. I want to say excuse me over any words that I may fumble due to not having my partial teeth. Anthony flushed them down the toilet 8 months ago. My job does not offer medical or dental, and the private dental plan I pay for won't come close to covering the cost of this work. There's a silver lining in him doing that, and that is when I asked him where my teeth were, he pointed to the toilet. He has no language and does not usually respond to questions, but that day when he pointed to the toilet, we completely understood each other. I currently have student loans from putting myself through massage school, being fully trained in this profession, and it was a passion of mine to bring healing and relief to people. My plan was to go into this field of work when moving to Lake County. That opportunity was lost due to the level of care Anthony needs. Also, my oldest son. A lot of providers have had to leave well-paying jobs to do what's right for their family. Still, I kept my chin up, making sacrifices, accepting that my new line of work would be to care and provide for them. the IHSS program has been a blessing for this reason. But today I'm asking our advocates on this board to stand up for us. If you've made a statement that you would be pushing for care providers to make a livable wage in this county, let your voice be heard. We are earning significantly less than a living wage. Please stand up and support us during these negotiations so that we can cover medical, dental, car insurance, grocery bills, flat tires without having to work 2 and 3 jobs. The entire community benefits from having trained, compassionate, caring providers for recipients. And this service keeps thousands of people out of expensive care facilities. So as you work through these terms, as we work through these terms of this contract, please keep our thousands of lake providers and their recipients in mind. I appreciate each and every one of you for taking the time to hear the voices in the county that you guys represent. Thank you.
Thank you.
Good morning, Board. My name is Luisa Costa. I am the representative with SEIU 2015. I am the person that represents all of the HSS providers in Lake County. And I just want to mention a few things. So a few weeks ago, we all witnessed when you guys presented the probation officers their very well-deserved proclamation. They invited 2 young men to give testimony of how the department has actually supported them through their recovery journey. I was observing, feeling something inside me because my daughter is one of those probation officers. She risks her life every time they go out. I get to see her income. They're also underpaid. I saw tears on a lot of the probation officers. It also brought tears to some of us. It certainly brought tears to me. Honestly, my tears were of guilt. Watching my daughter, thinking of the rest of my kids and how my kids could be one of those kids standing here giving testimony of how rough they had it. And the reason why I was feeling guilty, because I was one of those parents who had to leave my kids weeks at a time because I had to go work, because I could not find a job in Lake County that honestly paid enough for me to be able to have what I have now and to provide for my kids. That story is a story of many of our members. You've heard the testimony. Many of them who have children and families have to work 2 to 3 jobs. I watch them all the time. Sometimes they bring their kids because they can't leave them behind for meetings and things like that. All of this could be voided, including the 2 young men that gave their testimony. In my mind, I'm thinking, I wonder what kind of job their parents did that they were not there with them. And if they were, doing the kind of work that our members do, it's totally understandable. When our parents, our members, work 2 to 3 jobs, they don't have time to spend with their families. They are worried about putting food on the table and paying the bills. That is the situation with many of our members in Lake County, and not only our members, but many of the constituents here in Lake County. But you guys all can definitely help. You guys can help by putting your hand in your heart when you are making decisions on wages in our county. Okay, you guys have that power to lift our members' wages so that they can spend more time, quality time with their families. It's really hard for them to afford a lot. One of our members had never, ever been shopping at Costco. I feel awful and that hurt because she could not afford the membership. And just like her, there's many other members that have different situations because they can't afford it. Many of them cannot even afford to take the children to the local fair because it's getting expensive and there's no money. And nowadays things are tighter. So please, you guys have a unique opportunity to lift their wages and make their lives better. We really appreciate you looking into our proposal. And like I said, before you decide, put your hand in your heart and think about your family members who also have done IHSS or will do IHSS. just like Siva mentioned, we are the largest employers in the county, employees in the county, and they deserve better. Thank you very much.
Thank you. Is there any other public input?
Good morning, Board. My name is Simone Tapman. I'm actually reading a letter from another provider who had to go to work. So I'm going to read it like I'm her. My name is Joyce Thomas, IHSS employee for the last 3 years. I am grateful for the IHSS program being able to care for my partner. However, the reality is disgraceful. I make more money cleaning people's toilets than I do caring for someone's loved one. A clear example of how our society and our Lake County community values, respects, loves, and cares for human life and those in need of our service. We must do better. A living wage for home health care providers is a good start. In the words of John Trudell, I'm just a human being trying to make it in a world that is very rapidly losing its understanding of being human. Thank you.
Thank
Do
you.
I fill this out even though I read for someone else?
Yeah. All right, I know you came up, ma'am. Yeah.
Good morning, Board. My name is Leticia Guerrero, and I am here representing the members of Lake County. I am the coordinator for this region, and I have the pleasure of representing them at the table. And I just wanted to introduce myself to you and just let you know a little bit about the unused hours in this county in 2024. There was over 385,000 unused hours, which brings it to 9.7% in this county alone. Can you imagine how many people went without care? That's a lot of hours to have somebody without care, to have somebody without a caregiver, proper medical, everything, right? So that's a huge thing that we're looking at here is the unused hours. And as your population grows, the need for cost-effective care is going to keep on rising. People are not getting younger. People are being born with disabilities. These are things that are unavoidable. And so we want to make sure that you, in this round of negotiations, can do what's best for your constituents and value the work that they do. They give up everything. One of the sisters here was talking about how she thought she was going to have a career and she paid and went to school for these things. That's not just her story. There's so many providers that had really good paying jobs that had to give up their jobs to take care of a loved one or to take care of somebody who doesn't have a family member. We see it all the time. You guys don't get to hear the stories. You get to hear a little bit here and there from the people that come here because there's thousands of providers in this community. Could you imagine if each and every one of them came to share their story? I know that what we're saying may not make a difference to you and it may not change or may not pull on your heartstrings, but these are your constituents. They vote here in this community. They shop in this community. Our program is different from any other program. You get money coming in from the federal and the state and the county, so it's not like you're paying for this whole raise yourself. So if you guys can just look at your budget, we've gone through it. We know that the county has the ability to do better than what's at the table right now. We know that you guys can do better, and you can, and you will. Thank you.
Thank you. Any other public comment? Ma'am? Yep, come on up.
Good morning to the board. I'm Dr. Akila Elamine Bakit Markowski. I recently earned my doctorate in criminal justice, And I've never been an IHSS employee. Really don't know much about that industry. I worked for the state of California for a long time, and I've been retired for quite a few years now. So, but what I want to say is that I feel empathy for all the people who've spoken about what they're going through as IHSS employees. And because I was a single parent in Oakland when my marriages didn't work, as you've already met one of my sons, I have 4 more sons and a daughter. And I raised them off and on by myself. I put myself through college, Cal State University. Before I moved up here, I already had a bachelor's degree. I've earned a master's and now my doctorate in the last 15 years. It took me a long time to get the doctorate. But I want the people in the audience to know that if you keep trying, some of you will attain other things in life. It took me all these years to get my doctorate. I'm now in my early 70s, and that's okay, because as long as I'm alive, I'll be doing something better, hopefully, God willing, to uplift myself and my family and to encourage my son and my other children and my grandchildren to do better, and the people here in the audience to do better. I know that you're going through hard times. I've been through hard times too. But keep your head up, keep looking forward, keep asking God or whomever you believe in to help you. And I hope that you all will do the right thing and help them to do better with their benefits, with their wages, or whatever they're asking you for. I hope you will take it to heart and put yourself in their place if you can and help them because they need help. So please help them to the best of your ability. I know that you all gave yourselves a raise last year, at least that's what I read in the newspaper. So please help these people who need help. All of them deserve help because they're helping people. My own mother, who's 90 years old in Sacramento, is in need of help every day, and my dad, 88. My stepdad is doing what he can, and he had people come in and help my mom, who can't even get out of the bed, who can't turn over. So please help them. Because one of us might be in the same situation that other people are in today. I do everything I can to remain healthy. Eat organic food. Do exercise even in my house. Keep my mind stimulated. I'm always learning something new. And I'm always encouraging my children to continue learning. Because we don't know who we're going to need tomorrow. And one of you may need these same people today or tomorrow, or your children, or your loved one, your wife, your husband. Let's help these people to our best ability. Thank you.
Thank you. Sir, you've already spoke, but I'll give you another minute to follow up.
Thank you. It's a lot of rhetoric that's being said, and it's a lot of hypocrisy that goes on. When you believe in privilege, privilege isn't something that's given to you, right? Privilege is something that somebody else earned over time through hard work and dedication, education, and the honor and the ability to do it. They give that privilege to their children. But the smart and intelligent parent gives it to their child with the responsibility. I don't want to give you this empire if you will abuse what I give to you. Because all of the things that come with this empire, the employees, the pay, all of their health, and everything else that falls in it, the roads, the structures,
if we can wrap
all
up,
falls
please,
upon your shoulders. Now, I'm not telling you what to do, and I'm not trying to speak of the high and the low.
If we can wrap up.
The point is, power is fleeting. 1 minute you have it, the next minute you don't. If you do not listen to what these people are saying to you, your incumbency can be removed and taken from you. And I'm going to just
Sir,
say
if we could wrap up, please.
Yeah, it will be a wrap. I mean, it will be a wrap. You sit there now
Sir,
and do this.
I've given you more than enough time.
I know, and we have given you more than enough time. I'm telling you,
Sir,
I'm telling you right
we're
now,
gonna have
EJ,
to end now.
and the rest of you guys, I'm telling you, just like they're telling you. No, man, no. This needs to
Sir, that's, you've used
I know.
way than
I'm going to
enough.
abuse my time. I'm going to abuse my time right now because I'm feeling what they're saying. I'm an IHSS
Sir,
employee too.
We're going to go ahead and take a recess for 10 minutes.
So listen to what we're saying, man. Listen to what we're saying.
All right, so we're back from our break. Just going to open back up into our public input, and just want to, I know there's a couple more, so I'm going to give a quick note. This period is usually 3 minutes, and I've extended times for folks because I understand this is a passionate subject for many of you, and so I didn't want to cut you off. I know that would seem insensitive, and for you to come out here is very brave. I know this is dear to your heart, but we really have to keep it to 3 minutes. If someone else wants to speak, they'll have that opportunity to speak the 3 minutes after as well. So it's very imperative to stick to that. And when we say to wrap up, please start wrapping up. We understand it's emotional, but let's try to stick to the time limit if possible. We have another public comment. I know it was turned in. Okay.
Hi, I'm in District 2 in Clear Lake. Hi, my name is Vicki Osborne. I'm a proud member of SEIU Local 2015. I want to apologize for all the frustrations and everything that is going on right now, but you guys asked us to wait 4 months. We did. The providers are upset. So we want to say sorry, but this time you guys to step up and take what we say to heart and don't just say with your mouth. You support us in action. Show us. Because we did wait the 4 months that you guys requested. Thank you.
Thank you. Is there any other public input? All right, so we will go ahead and close public input. Thank you for giving us that insight and coming on record and talking about this.